individual sort of balance where you're not fighting with this flopping back and forth and everything. You can see things real well. Now, these are double injected pigs, so they have access to jugular vein and injected a blue latex to try to fill up the venous side of the vasculature to make it easier for you to see. And they have injected the umbilical artery with red. So that umbilical artery, of course, goes right down into the aorta and tries to go throughout. These pigs have not injected all that well this year. The ones that I've done with the other labs, they've been kind of marginal. So we'll see as you get in here. But again, don't worry too much about the blood vessels and the nerves. As you're looking at your lists of things that we would expect you to know on the pig that's in your lab manual, all the internal organs and the cavities and things like that, yes, definitely. Blood vessels, the larger blood vessels like the carotid, the jugular, vena cava, aorta, yeah, I'd expect you all to be able to see those pretty well. But the smaller blood vessels, many of those are really pretty tough to see. So don't expect me to be sticking pins in those to ask you what those are. Okay, female, external genitalia. So you know that's a female. That's referred to as the vulva. Okay. In human beings, of course, we use the term labia, but in animals we generally refer to that as the vulva. And then, again, either later on today or Tuesday as we go back and review, I'll go over the male with you, and so we'll look at the scrotum and the testes. Umbilicus with the umbilical artery and urachus tied off right here, which you'll follow down as it goes in later on when you open up. So first things first, just get the animal where you can bounce it and deal with it, and the best way to do that is to just partially disarticulate the forelimbs and the hind limbs. And on the forelimb, if you remember back in A&P1, there really is no true articulation between the scapula and the ribs. It's just overlaid by muscle and connective tissue, right? So you can just take your blade and go right down between the two and essentially just disarticulate the scapula and just leave a little bit of skin. And of course, you don't have to worry, you're not going to get in the chest cavity. There's nothing in here that you need to worry about naming.
Is that because they're four-legged? That's why it's designed like that, or no? Because they're...
We're designed exactly the same way. Remember back in A&P1, if you look at that.
Yeah, but...
You know. And if you had to, in fact, do we not first start out on four limbs?
Sure.
We crawl before we walk, do we not? So again, we go through our phase of this four-leggedness for a while, but our brains are such that we can gravitate up and go to two legs. Okay, so same thing on the other side. Now, as I get these laid out now already, you can see I'm starting to get some balance here, so I'm not fighting with the specimen as it's going back and forth. And then do the same thing with the rear limbs. Now, with the rear limbs, you have to be a little bit more careful because you don't have the rib cage to protect all the internal organs. You do have the abdomen right here, the abdominal wall you can cut through, and you do have the female reproductive tract that will be right on the midline here. So when you're doing the rear limbs, just try to palpate for those muscles of the inguinal area here, and try to stay as close to those as you can. Now with this, again, you'd rather get into the muscle a little bit more than over into the abdomen, just to avoid cutting through anything that you don't want to. And here you do have a true articulation, right? We've got the acetabulum and the head of the femur down in here. And that can be a little tough to get through. If you do it just right, and I've gotten lucky right here, I actually ended up right on top of the acetabulum right here. I can actually cut that couple of the ligaments there. And if you put just a little bit of pressure on that, you can just sort of disarticulate that, and again, the limb will just sort of lay over flat, and then do the same thing over here. Okay, and I got right down to the head of the femur there. Disarticulate. So there's the wall of the abdomen, which I've missed. A lot of the internal organs are still in good shape, but just a little bit of pressure on that again to disarticulate, and now I've got that laid out flat, so you're not fighting with it either way, right? So now you're ready to go ahead and remove the skin and get into the areas that you actually want to see. And for that, just stay right on the midline. And you want to go pretty high up here, probably just right underneath the ramus of the mandible here, right on the midline. Stay pretty shallow. All you need to do here is cut through the skin, come all the way down until you get to the umbilicus. And you'll want to go around it because you'll want to keep the umbilicus intact. Doesn't matter which side you go, whatever's convenient. And then just go right around and continue until you run into one of your cuts down in here. Okay, so now I can begin to see I've got a full thickness cut on the skin. Now there's a couple of different ways you can begin to get the skin back out of the way so you can do your deeper cuts. If you're comfortable using the blade like this, you can just sort of get the blade up underneath. This can be a little tedious because the tissues are a little bit slippery. They can be a little tough to get a hold of at first. But this will work just fine. Sometimes a quicker way is what's called undermining the tissues. And this would be actually the true surgical technique you would use if you were trying to separate tissues without cutting anything. Place the scissors in the area that you want to undermine, and rather than doing this action and cutting, you do the reverse and open up. So it's a blunt dissection, right?
What's that called?
See? It's called undermining,
Undermining?
right?
Okay.
See, as I go through there,
Yeah.
so I put that in there. And the nice thing about undermining the tissue is I'm not using the sharp portion of the blade. So if there is a structure, a vein or an artery or whatever I want to see under there, I don't have to worry about cutting it in two. I'm just pushing it to the side.
Yeah.
Right? And if you use a big enough pair of scissors, you can actually undermine tissue very quickly. See how quickly I can get that skin peeled up off of the deeper tissues there? Right? And then if I get a little area like this isolated over the top of the rib cage where I know there's nothing there that I'm afraid to cut, then I can just go ahead and cut it because I know what it is. Right? It's just the skin. Get an appreciation of the fascia there. So that's how we're all put together. So you get layers of skin and layers of muscle, and then you get this sort of web-like appearance. Right? That's just the fascia, the connective tissue that holds all the pieces and parts together. Same thing up here in the neck. Get an opening here just to undermine the tissues as best you can. And you want to do this on both sides. And try to take this up pretty high because you want to get a glimpse at the salivary glands. As I get up in here, if I get high enough, I'll be able to see the parotid salivary gland. We should be able to see the submandibular glands here. Okay. And then the same thing over here. A lot of times I think this goes a lot quicker and a lot safer than using the blade because you're not dealing with the sharp edge, so you're not so worried about cutting your finger or slicing anything up. Okay, now once you get here, and again, you'd want to continue your undermining of that skin up through the neck so you can see that entire area because you're going to need to remove these cervical muscles off of here to be able to see the larynx, trachea, esophagus. Thyroid gland will be sitting right on top of the trachea as you get down in there. Looks like you may have part of the thymus gland way up in here. We sure do. Thymus gland is a strange organ in all species, but in the pig in particular. See this sort of cobblestone appearance through here? See how that looks very sort of diffuse right there? See, for comparison, right here you've got one of the cervical muscles right here. See, so that looks nice and smooth and shiny, just like you have down here with the intercostals. Right? And you can see the same thing back in here with the muscles of the upper leg, gracilis and the semitendinosus and all those. See how smooth that muscle tissue is? When you get up in here, you get that sort of a cobblestone appearance. That's very typical of glands and how glands are put together. So the pancreas is going to look very much like that. The salivary glands, as you get down here, will look like that. They'll have that sort of cobbly sort of an appearance like that, rather than being all smooth tissue. So that's probably part of the thymus right there. My suspicion is once you open up the chest, we'll also see some of the thymus here. It can be a very diffuse gland. It's always going to be superficial. We did some pigs the other day in one of the 15-week labs over there, and all of the thymus was located down, it was literally embedded in the pericardium down in the chest cavity. So again, lots of variation there. So you'll want to...
Is this a developmental thing, where it's located? Or?
It's a transient gland, so it just develops somewhere in the cervical chest region, does its job up until puberty, and then it atrophies away.
So it doesn't matter really where it's at.
Exactly. Yeah, it just doesn't have that restriction of having to be fixed in place for life. So it'll show up as various glands all throughout. As I cut a little bit more, you can get an idea now of the cervical muscles. You can begin to see the jugular vein over here that's been tied off. So as you're doing your dissections, and again, this is nice, you don't have to just do the blunt dissection for skin. As I'm coming down in here and I know that I've got blood vessels down in there that I want to see, I can look at the boundary between two muscles and begin to do the same kind of thing and just sort of gently peel apart like that. And so I'm breaking down the fascial planes between the various tissues, and then when I identify, okay, that's just a muscle right there, I'm not interested in that, we've already done muscle physiology, and I want to see the deeper tissues, then I can cut that and get down in, and now I'm getting down in the area where I can see right on top of the larynx here. And you will want to use your fingers a little bit, do tactile response, because I can tell very clearly this is the larynx because I can feel that cartilage, right? It's really full. You'll see the same thing when you get down to the stomach, and you'll feel a caloric sphincter is much tougher and thicker than the rest of the stomach is. You know, so don't just use your eyes, use your fingers a little bit too. That will help you as well. A couple of different ways you can get into the chest cavity. Ossification has already begun at this stage, so there is some mineralization, but a lot of this is still just in its fairly early stages, and some of it hasn't mineralized at all, so it's not going to be very tough to get through. You can either use the blade or the scissors again. Generally, if you stay just off the midline, again, remember your anatomy where the end of the rib stops and you've got a little hyaline cartilage before it joins with the sternum and manubrium. If you stay a little bit off the line, you'll have nothing but cartilage to cut through, and that can be very easy. And I hit it just about right there. You see how I'm almost no pressure at all there, and I'm cracking the chest right on the midline, right? So this would be an open heart surgery procedure. In an adult, we'd be using saws and all sorts of stuff to buzz through all that bone, right? Don't necessarily have to do that at this point. Okay. And then take that all the way up to the last rib. And again, you could, if you're more comfortable with it, once you get an opening here, you could do the same thing with your scissors and just cut. But if you do that, make sure you stay real superficial, right? Because you are getting down into tissues that you're going to want to recognize at this point. And then from there, once you get the skin cut down, you can just separate it away. You can pull it all the way down the length of the body wall like this. Give yourself plenty of room to work. And then palpate and find the margin of that last rib. And then you can just carry your cut right down the margin of the rib. Again, staying right up next to the body wall so you're not cutting internal organs in there. Take that all the way down. You see, we're already beginning to get the concept of spaces in here. All right, so we've got, you see a little bit of lung peeking out right there, so that has to be the pleural cavity I've just entered. Right, so we're looking at the pleural membranes there. And I'm right on the edge of the abdomen, so this is peritoneum down here. So again, be aware of spaces as you're going in here as well. I'll oftentimes ask about the pericardial space or the pleura or the peritoneum and that kind of stuff aside from just the organs themselves.
What do you mean? You would have a pin in it and say what this is? Or?
Sure.
Okay.
So let's go ahead and continue this out then. All the way up to the top, separate up through the first rib. And again, I can do the same thing. I'm taking it down the last rib, and then I'm taking my scissors and just go right down the first rib there. Yeah, do be careful, because as these things sit in the buckets, they will supersaturate. So there are times when you'll have fluids in there. So yeah, just be aware. Occasionally you'll push a little fluid out of there as you open up a pocket. So yeah, you don't want to be like down in here like this. That would be a bad thing. Okay, and then again, these ribs really are thin enough that you can just take your scissors if you want to at this point and literally just cut a little window. Right, and lay that back to the side. Right now I've got a nice window with my organs intact. I can begin to see the lungs and the heart is intact. In fact, I've even saved the entire pericardium there, right? So you see that membrane slipping over the heart. I begin to see the heart peek up. There's the surface of the diaphragm, right here. And I've just entered the abdominal cavity or peritoneal cavity right here as well. So that's part of the diaphragm, and then so that's going to be the surface of the liver. Right. So and then rinse and repeat on the other side, and then when you get both of those laid over, now you'll have the entire thoracic cavity in there. Work your way up through the neck, and again, this gets a little tedious in here because you are going to have to get some of these cervical muscles off of the top. I can begin to see there's a submandibular salivary gland peeking out right there. That's not a very deep dissection. And I can see larynx right there, but I'm going to have to remove more muscles here to be able to see the carotid arteries on either side and the thyroid gland there as well. Right? And if you get pretty comfortable with your neck dissection and you open the thoracic area and you're pretty comfortable with all that anatomy, you want to move on down, then just continue your incision right down along the midline with the abdomen and just peel the abdominal wall to the side. And that's all you'll need to do. So it'll take you a little while to get him all laid out, get the skin to the side, all that kind of stuff. Again, you've got scissors over there, blades to cut with as you need, and all sorts of gloves. Should be in good shape, right? So I'd say dive in, do maybe 2 pigs, divide into groups of